Hi, my name is Nina and I'm going to be presenting on Addison's disease. Some of the most common symptoms of Addison's are dark skin pigmentation, low blood pressure, nausea, depression, abdominal pain, and sometimes diarrhea. Some people may experience only a handful of these symptoms while others experience many more of them. For diagnosis, one can be diagnosed with this disease by reviewing past history. Like if in the past you have had problems with your adrenal glands, you may be at higher risk of having Addison, so we check into that, as well as a physical. And even blood tests can help diagnose this because they measure the level of sodium, potassium, cortisol, and ACTH in your blood, which also lets us know how your adrenal glands are functioning. ACTH test can also be performed to test adrenal response after you are given a shot of artificial ACTH, again to check the function of your adrenal glands. An X-ray and CT scan can be used to identify calcium deposits on the adrenal glands and just make sure that they are properly intact. Some risk factors include those who have cancer, those who take blood thinners or have chronic infections, as well as people who have had adrenal surgery in the past or have an autoimmune disease. When the adrenal glands properly function, they produce normal levels of hormones in order to maintain metabolism, blood pressure, and responses to stress. Those who don't have Addison's disease produce normal levels of cortisol and aldosterone, which cortisol allows the body to respond to stress, but it can also maintain blood pressure, heart function, and maintain the immune system. Aldosterone affects the balance of sodium and potassium within the blood, and without these two hormones, our bodies can't respond to change. Therefore, they can't maintain homeostasis. The image depicts a regular hormonal cascade of cortisol. So once the body faces stress, the hypothalamus in the brain releases CRH, which causes the pituitary gland to release ACTH, and that results in a release of cortisol. And this cortisol release goes to specific regions of the body in order to respond to the stress. And this loop eventually shuts off this cascade until it is needed again. Like I mentioned on the previous slide, cortisol regulates metabolism, blood pressure, and stress. So when a person who has Addison's disease, they have a lack of cortisol production, which creates several problems within their body. And this is due to the adrenal glands' inability to function properly. And this results in muscle weakness, nausea, along with many other symptoms we mentioned before. So treatment for Addison's. Treatment for Addison's includes hormone supplements like hydrocortisone, which is identical to cortisol, and this is given in 2 or 3 divided doses with a typical daily dose of 15 to 30 milligrams. And fludrocortisone can replace aldosterone, and doses consist of 0.1 to 0.2 milligrams orally once a day. And this is, well, the doses vary from person to person, so those are just like average for anyone. So normal hydration and absence of orthostatic hypotension are evidence of adequate replacement therapy. And some people may experience complications such as, well, fludrocortisone can cause hypertension, but it can be treated by reducing the dosage. Like I mentioned, not everybody takes the same amount of supplements to help their adrenal glands create these hormones again.